Hi, students. I am going to go through your outpatient assignment. So we're going to start right here with case one. We have a female patient, 17 years of age. So I put that all into the encoder. Okay, we have the date, have that listed. One thing you want to make sure that your product is going to be APC. Okay, this is really important. So we're going to go to APC Finder. Then I'm going to hit continue. All right, so with this, we have a primary diagnosis. So we are outpatient, and it tells you right here, 13X. Go ahead and click that. Primary diagnosis is what we use for outpatient. You'll hear principal diagnosis for inpatient. So let's go here. We're going to go ahead and put in the left lower quadrant abdominal pain. We're also going to code the lactose intolerance, dysmenorrhea, and don't forget that 992834, the E and M, which we're going to code it as our procedure code. So that is for the ER. So we're just going to start off here with the R10.32, and we need all of these since we are coding outpatient. And then we're going to go E73.9. Push this over here just so you can see I'm hitting add diagnosis. And then add diagnosis to our last one is N94.6. All right. So that's what we have for our diagnosis so far. Let's go down here. For the encoder, what is the APC? Well, we don't know yet because we need to put in 99283. Just bring that over. And I'm going to go ahead and add procedure. Type in 99283. All right, so here we have all our information. So right here we have our 05023. That is our APC. Okay, that's going to be right here, APC 1 05023. There's our E&M code, 99283. Okay, so then when I go down here, what is the amount? $271.93. The total's right up here. Okay, so let's go and move on to our second patient. Okay, this one here, we have a male patient right here, 12 years of age. We have the date, January 7th through January 7th. APC Finder again, we're going to hit continue. Right here, 13X is where we are going. So let's go ahead and go down. What do we all have going on here? We was transferred to a large children's hospital, but for admission for his sickle cell crisis and acute chest syndrome. So the ED physician documents, we have our level. So let's go ahead and get our primary diagnosis put in. So D57.01. That is going to be our HBSS disease with acute chest syndrome. Okay. So right here, right now we don't have an APC because we need to get our 99284 in. Move this over, add procedure, 99284. All right, so now, one nice theory, you can always look here, make sure you use additional code only if it's present. Keep that in mind if there was a fever. All right, so let's move on down here. Once again, our code here for APC, or I should say our number is 05024, so level 4. Okay, for the encoder, the estimated total reimbursement under Medicare is over $500. Okay, this is false. Right here, Medicare is $344.29. Is what they're going to pay on this visit. Right, so let's move right along here to patient number 3. Okay, the same thing here with patient number 3. We have a male, 1 year of age. We have the admit, same day here again, 1/4/23, 1/4/23, APC finder again. Hit continue. Same thing, 13, no unknown condition, so it's the first one. We have admitted to outpatient radiology. They're having a TEE echocardiogram for monitoring and assessment without contrast. This is done to evaluate an atrioventricular canal defect. This has been present since birth. So when you figure that out, let's go ahead and go with Q21.20. If anybody has an issue on trying to find any of these or why I coded the ones that I did code, please send me an inbox. Happy to walk you through that. All right, so here we're going to have 2. We got the TEE. So let's go ahead, add that procedure. So I have 933.1, and that's going to give me the AAPC 05524, level 4 imaging without contrast. All right, so let's go, and that's all you're doing for that case. So, all right, we're going to move to case number 4 with a 59-year-old female. I have the dates in, APC finder once again, hospital 13X, no unknown condition code. All right, so let's go ahead and look here. We are going to enter our primary diagnosis. This one here, when you read through it, let's go down here. Primary diagnosis documented by Dr. Massey. Melena and possibly a duodenal ulcer. Keep in mind, we can't code possibly in an outpatient setting. So we are going to go with the K9 2.1. Let's go ahead and put that in. With that, we have our primary code, and then we're going to go right to the EGD. Keep in mind, it does state that they did not go to the ileum, so they only went as far as the duodenum. So let's go ahead and add that procedure with that. So I'm going to move down here, which is 43235. If anybody has any questions on how I found a procedure or a diagnosis code, contact me and I can walk you through the process. So once again, our APC here is 05301, and that's really all they're asking for on this case. So let's go and finish up here with case 5. All right, so case number 5, our last one here. We have a female, we already have that in, 73. And once again, the date needs to be 1/30. All right. So, all right, we have APC finder. So let's go ahead and hit continue. The same bill type. And then let's look at our keyword here. They're coming in for a radical excision, the 2.0 centimeter malignant melanoma, the left eye. So we're going to start here with our primary diagnosis, C43.72. Right, malignant melanoma, the left lower limb, looting hip. Then we're going to go for our procedure. Once again, contact me if you had any issues finding the correct procedure. All right, so with that, with our procedure, this is, okay, so back to this, one thing to remember with code 14021, this is an adjacent tissue transfer. Whenever you have a tissue transfer, you do not code the excision, right? That would be unbundling your codes, and that is something you do not want to do in CPT. So I went ahead and added that. Here is our APC code 05054. And that is it. If anybody has any questions on this assignment, please let me know.